Honorable Ministers, State Secretaries, distinguished delegates, welcome to this special session on equitable access to drinking water and sanitation, where we will discuss the fair and smart ways to reach universal access. I will be the moderator for this session, which will take about 2 hours. My name is Harsha Ratnavira, and I'm a professor on water and wastewater engineering at the Norwegian University of Life Sciences. And I have had the honor of assisting the governments of Ukraine, Kyrgyzstan, and Tajikistan in setting targets according to the Protocol on Water and Health. Already in November 2002, the United Nations Committee on Economic, Social, and Cultural Rights commented that the human right to water is indispensable for leading a life in human dignity. It is a prerequisite for the realization of other human rights. This comment also defined the right to water as the right of everyone to sufficient, safe, acceptable, and physically accessible and affordable water for personal and domestic use. As the director from the WHO stated, on 20th July of 2010, the United Nations General Assembly explicitly recognized the human right to water and sanitation and acknowledged that clean drinking water and sanitation are essential to the realization of all human rights. And as the Minister of Health from Norway reminded, still there are 19 million people in the pan-European area without access to safe drinking water, and 67 million people still lack access to improved sanitation facilities, despite the progress which we have seen during the last 10 years or 15 years. And as the director from the UNECE pointed out, there are still a lot of disparities. These figures could be interpreted in different ways. The disparities within and between the countries, between urban and rural areas, as well as between the high and low income groups are even more disturbing. And we know that the poor and the most vulnerable and marginalized groups and rural populations are the most affected in this situation. In this context, the Protocol on Water and Health has a unique role and importance. This is the reason to have this special session with you today, ladies and gentlemen. The Protocol on Water and Health provides a sound framework for the translation of the human right to water and sanitation into practice in this pan-European region. It requires that the parties ensure universal and equitable access to water and sanitation within their national targets and capacities and deadlines set. Today, the world economies have great challenges in access to financial resources. Both the developed and developing countries, or the donors and recipients. So in this situation, we need to be smart and smarter in securing equitable access to water and sanitation. Firstly, the policies need to be smart to favor those areas and population groups that so far have been left aside because it is complex to access them. Secondly, they have to be cost efficient. So, ladies and gentlemen, the objectives of this special session is to discuss the progress made in the pan-European region in advancing universal access to safe drinking water and sanitation, and to assess to what extent those advances have been equitable, and to review what needs to be done to ensure that the common goals of universal access is achieved in a fair and smart way, and also to call upon parties, other states, financial institutions, and development agencies for actions and commitments to eliminate disparities in access to safe drinking water and sanitation. This session is organized in 3 parts. After the introductory remarks, we will first listen to 2 keynote speakers on the challenges and the way forward. Then we will invite countries to provide high-level statements. Followed that, we will have a panel discussion where the representatives of governments, NGOs, and international organizations will participate. Hopefully, we will also have some time at the end of this session for questions and comments from the audience before you leave for dinner. With that brief opening statement, let us start this session. The human right to water and sanitation requires that these services are available, accessible, safe, acceptable, and affordable for all without discrimination. I would now like to invite Benoit Wallet, General Director for Health, Ministry of Social Affairs and Health, the Republic of France, to give introductory remarks to this session.
Thank you, Mr. President. Dear Excellencies, dear Minister Representative, delegates, ladies and gentlemen, it's my pleasure to be here for my first trip as General Director for Health in France. I represent here Madame Marisol Touraine, who was not able to make the trip, and I have to apologize for miss for this meeting. I have also to apologize for the fact that I will not be able to stay very long during this discussion. It would have been a pleasure for me to do so. And also I'd like to mention the fact that I'm not a specialist on water, although as a medical doctor I've been involved in how to treat patients and to be very careful about water. I have to say that the view that I have to share with you now is much broader and certainly very interesting for the health of people. Also, I apologize for the fact that I will make this speech in French because it's a national policy in France, and so I certainly thank very much the translators for this presentation. So I leave you put the helmets on your ears in order to start. Donc une résolution.
So, during the World Health Assembly, at its 64th session in May 2011 in Geneva, a resolution was adopted, and in the context of the activities in line with this resolution, but also the Millennium Development Goals that relate to water and the Protocol to Water and Health, aims to improve a situation which remains sensitive, this pan-European situation. The protocol's activities, which are our reason for being here today, concern important subjects for our public policies: systems for water provision, risk assessment and management, warning and assessment systems, and also the notion of equitable access. As for France, and since here we're talking about what France is doing, many activities for equitable access to water and sanitation have been undertaken since the first meeting of the parties to the protocol in Geneva in 2007, and this commitment was renewed during the second meeting of the parties to the protocol, which took place in Bucharest in 2010. And this year, 2010, was the year in which the human right to water and sanitation was recognized by the United Nations. And what was said was that until the right to water and sanitation is fully realized, including in developed countries, where the social costs are significant, many citizens will suffer the health consequences of this marginalization of water, and the figure that has been mentioned many times is of 1 million people in Europe who do not have access to drinking water. What is significant is the concerted efforts that are made collectively And this collective element is important to strengthen capacities for intervention, sharing of experiences, promoting best practices, and promoting effective policies and strategies. This governance should be global in a world which is undergoing globalization, and water policy, as well as the necessary adoption of legislation, will need to differ from state to state, but they will need to be put together in consultation. In France, significant commitments have been taken on the public health front. For example, first of all, through a national plan on non-collectivity sanitation and the National Health Environment Plan for the period 2009 to 2013. And this plan will be renewed for the future with specific activities relating to drinking water. On the social front, and because inequality to access is also related to social networks, France, for nearly 10 years, has been providing access to a solidarity fund for housing, which helps to those people who cannot maintain their access to water for financial reasons. It ensures that they benefit from this housing solidarity fund. And it amounts to several million euros in subsidies. A law published in 2013 stipulates a pilot study to be undertaken for a period of 5 years to promote access to water and to establish the social tariff setting for water. These pilot studies are undertaken by local authorities, which do so in link with water services and the social security bodies. And in France, water management is both public and private, which gives us many possible ways to approach this subject. This is part of France's efforts to improve access conditions for water and sanitation for all, including in vulnerable urban populations and rural isolated populations. And as you know, in the self-assessment that has been proposed, and which I will mention later, a very specific point is made for isolated populations, both socially and geographically. Access to drinking water and sanitation is a challenge which requires all decision makers and operators with central and other regulation, but because of geographical reasons, it should also be local regulation, because they can also play a vital role. Henceforth, access to water and sanitation requires the better integrated management of resources, and, as you know, increasing competition exists in the various sectors of water use, whether in terms of domestic needs, agriculture, industry, as well as environmental needs. And so a certain prioritization must be done, which will involve regulation and the bringing to the responsibilities of the private sector. Various approaches will differ from party to party, but their relevance can be useful to all of us, since the broad areas of our work and goals are shared between us, as I said in my introduction. This is a work that we have to do together. I should like to recall here the importance of the publication of the guide, which was produced in March 2012 in Marseille, No One Left Behind. This guide, which is available in 3 languages, French, Russian, and English, is a synthesis document which presents the 5 key themes around which the self-assessment guide, which I'm going to mention later, has been based. Promoting water and sanitation for all under the auspices of the political implications and decision-making processes, whether it's an important decision for policymakers, guiding governance towards providing equitable access, guaranteeing access to vulnerable and marginalized groups, keeping water at an affordable price for all, or ensuring that it's free in very marginalized social situations, and reducing geographic disparities. As you know, these are the elements that are put forward in this guide, No One Left Behind. In order to know whether these goals can be achieved, we need to put together assessment tools so that we can be sure that decision makers, social actors, and water professionals can, at a given time, come together and discuss what is at stake behind these goals. I therefore have the honor and the pleasure of announcing to you today, which I've mentioned earlier, the publication of a second document. And we believe it will be a landmark document, and it will be presented during the general debate. This is the self-evaluation tool, the Equitable Access Scorecard. So it is a self-evaluation, self-assessment and support tool which has a scorecard allowing people to assess these systems that I've mentioned, allowing us to know in terms of national policies and regional or local organizations whether the organization of equitable access to water and sanitation is indeed present. And you will see that these are very pragmatic measurements where it should be of no difficulty to provide an assessment. This tool has already been tested and its operational aspects have been assessed in both Portugal and Ukraine, as well as in France, in the Paris region and its surrounding area. And even if Paris isn't France, nevertheless, it is a significant part of France which represents the diversity of our country, both geographically and socially. So it's an opportunity for me, and on behalf of Madame Marisol Touraine, our Minister of Social Affairs and Health, to very sincerely thank the parties that actively participated in close link with the Joint Secretariat of the Protocol in the working groups that France organized in Paris over the last 3 years. These have allowed for these achievements. Therefore, on behalf of the French government, I would like to thank the representatives of governments and non-governmental organizations, in particular those of Hungary, Portugal and Ukraine, as well as Mama 86, which I now know a lot about, although I didn't before, and I believe that they will all do us the honor of speaking during this panel discussion. France would very much like to continue to focus on activities relating to equitable access to water and sanitation, and would certainly hope that for the upcoming 2014 to 2016 period, we would be able to share this responsibility with another party. Therefore, we would like to express that wish. So thank you all, and I wish you a very good session today and for the coming days ahead.
Thank you, Mr. Vallée, for those words and information which is provided. Then we will have the keynote speeches. We are going to have 2 keynote speeches today. First, I would like to invite Mr. Graham Alabaster from the United Nations Human Settlements Program, UN Habitat, to address us on the challenges and way forward from a developing and recipient perspective. Mr. Alabaster.
Thank you, Mr. Chair. Distinguished ministers, distinguished guests, ladies and gentlemen, I'd like to share with you the thoughts on achieving the strive to universal access. As you know, we live in a changing world. There are many issues relating to access, and the fact that we need to understand how the world is changing very carefully in order for us to keep up with the process are very important. I think, of course, most of you know that the current global population growth is growing fastest in the 50 least developed nations. And when we get to 2050, a large proportion of the world will live from the less developed regions. We're going to see changes, of course, by the social structure. In fact, we have an aging population in many regions. And also by 2050, we will have a large proportion of people who are elderly. Perhaps one of the most significant issues, though, is the fact that the world is urbanizing at a very fast rate and becoming increasingly urban. But what's more important is that the main growth in urbanization will not be in the megacities. It will be in the smaller urban centers, the large towns and the villages where not only is there explosive urban growth in some regions, but there's also a lack of capacity to provide basic services. If you look at the current work that's being done on quantifying this proportion of poor who live in urban areas, We know, for example, that in Africa, in sub-Saharan Africa, the percentage of very low-income populations is very high. Equivalent figures are given for Asia and Latin America. But in the Euro region, it's very diverse. We don't exactly know. And it may surprise you to know that there are some slum populations in some very developed countries in the Euro region which go unnoticed and below the radar. In addition to the social and demographic changes, we're of course faced with huge issues in relation to climate change, particularly extreme climates causing drought on the one hand and flooding on the other. We can expect these to increase in the forthcoming decades. The other issue, which of course is of extreme importance, and we're seeing in other parts of the world, is the impact that conflicts, both local, regional conflicts, have on access to basic coverage. But in these situations, as is usually the situation, it's the very young and the very old who are the most at risk. But we mustn't forget that the impacts will be felt not just in the poorest countries, but also in the developed world. This slum challenge, to bring it home and to give you a feeling for how many people we're going to see in the next few years, about 38% of the world's urban growth will take place in slums. And it may surprise you to know that the second picture I show on the screen is actually from a London suburb, believe it or not. This is a slum within the boundaries of London, which is not radically different from the sort of thing that I am used to seeing in the developing countries in Africa and Asia. So within Europe, we still have issues in relation to slum. A lot of these are in relation to migration. But if you ask the authorities about slums in London, of course they don't exist. So we shouldn't forget that these do exist in many parts of Europe, and the issue is they're below the radar, they're not detected. One of the interesting issues about these secondary towns, and something that's very, very important, is as the urban sprawl grows, we find a low-density, peri-urban area, which is exceedingly difficult to provide services, to provide piped services of water and sanitation. This reduction in density pushes up the cost, the per capita cost of services. And the understanding is that if we allow this urbanization in the small villages and towns to go ahead unchecked, we will be facing an even bigger problem because of the lack of planning of these urban centers and the sheer escalating cost of provision of service. So not only are these countries in a difficult situation, the poor countries, they're also going to be further exposed to this issue of challenges in relation to water and sanitation provision. So why has water and sanitation been neglected? The whole status of water and its sanitation as a basic foundation for good health has been neglected. If you look in many countries throughout the world, local structures, local public health officers who were in place to monitor and give feedback on the health status of communities, both in rural and urban areas, have had their priorities diverted away to other issues, to other priority diseases and outbreak control. And the health importance of water and sanitation has been neglected. This is why the protocol is so important. It brings back the health focus to water and sanitation. And because of this, the information is aggregated to a level where the inequalities are masked. So basically what we're seeing is when we look at the overall picture of coverage, as is particularly the case in some European countries, we find that these small pockets, these isolated pockets, are forgotten, and these are the places where the health situations are really difficult. Of course, the issue of urban and rural in definition is somewhat different because, as many of you know, the definition is somewhat technical, and it's up to governments to define whether areas are rural or urban, and that changes depending on which part of the world that you're in. But the reality is, wherever you go, this urban sprawl is one of the biggest challenges to the provision of basic services. So what is it that we can do to address these challenges? First off, to better understand this disaggregated nature of service coverage. And one of the great tools to achieve this is, of course, relying on communities. And the protocol, as you've just heard, is about to launch this very interesting idea on report cards, which enables us to have a much better understanding of the levels of coverage in these poverty pockets around the world. The second important issue is to understand that, of course, this provision must be focused first on the poorest in these poverty pockets in urban areas. But secondly, the poor should also not be denied access to higher quality systems. They shouldn't be denied access to network services for water and sanitation that we all enjoy. There's a feeling that, you know, basic sanitation means things like pit latrines and things like this. Most people around the world, in fact many in the rapidly developing regions, are not prepared to accept that as an adequate level of service. So we do have to find ways of developing basic facilities which can be progressively upgraded to give people a decent level of service. If that's waterborne sanitation and that works, that's very important. Moving now, what implications does this have for the development agenda and the SDGs in the post-2015 period? We know, as we speak, the preparations are being made to support the idea of a water goal in the SDGs. Many governments are supporting this idea. And the challenge here is to effectively combine the different streams of water and sanitation together into a holistic goal. And that includes not just the water and sanitation, but also the wastewater management. Wastewater is an area of increasing concern for many of us. And of course, the issue of water resources management. We also know there are opportunities within the health goals to recognize and strengthen the importance of water and sanitation as a cornerstone of health. And the other, of course, issue is to ensure that urban development is enhanced and not impeded by the provision of these services. In terms of the Euro region, and again we have a diverse situation that exists here, we know that water and wastewater quality will become an increasingly relevant concern. There's been a lot of work going on at WHO and other agencies to look at water quality. But we've also facing in the region lots of issues in relation to toxic and hazardous substances and priority pollutants. And of course, one other thing, which is also of extreme importance, is the situations with antimicrobial drug resistance in wastewater. It's not an area that we currently give enough consideration to in our work, but it will become increasingly so over the next few years. As I mentioned earlier, water quality monitoring will need to be enhanced, and we'll need to have much better ideas about the definitions of safe and adequate water. These are somewhat subjective. They need further definitions, and it's up to countries to define how they would wish to classify safe and adequate water. There are some critical issues in the region. You saw from my slides of my hometown in London how we have a situation where there are migrant populations who are living in slum conditions in Western European cities that we need to consider for access to services. And of course, my plea for better understanding the idea of the fact that these poverty pockets and small urban areas are masked by inadequate data. We need much more data and we need better data. And the key to that is engaging with communities and other actors in the water and sanitation sector. We heard from the previous speaker the role of local authorities have played in developing local plans. This, in my opinion, is a very critical area we need to focus on, and something the protocol can help very clearly with. So in terms of conclusions, we must give due consideration to the fact that we are living in a changing world, and the three major issues that we have to contend with in terms of service provision are urbanization, climate change, and in some areas, conflict. We need to understand urbanization far better, and to understand that actually the way villages and towns in rural areas are changing rapidly. They are developing urban characteristics which we have to be aware of and make provision for in the providing services. We have to ensure local authorities and support the profiling of resilience profiling for some areas, those that are at risk from extreme climate events. And we have to realise that in some regions there are areas where conflict has resulted. I can give a good example of outside of the region, for example, where the refugees currently from Syria are putting a huge burden on Jordan in terms of provision of services. This is a regional issue, and it's something that could happen in other areas. So finally, we need better data and information. We need to recognise that the inequalities are often masked in the official statistics. We need to further build on the critical understanding amongst people outside of the water and health sectors that water and sanitation makes a huge health improvement. And many of the instruments developed under the protocol can greatly assist these challenges in understanding the needs of marginalised communities and how they can best participate in some of the solutions. Ladies and gentlemen, thank you very much for your attention.
Thank you very much, Mr. Alabaster, for those thoughts and views, which again confirm how strongly the inequities are masked. There's a lot to be done, a lot can be done. Then I will invite Mr. Manuel Thonhofer from the Swiss Agency for Development Cooperation to share your views on challenges and the way forward from an industrialized country and from the donor perspective. Thank you.
Thank you very much. Excellencies, distinguished delegates, ladies and gentlemen. I want to address drinking water and sanitation challenges from the post-2015 perspective. And I would like to look at the post-2015 development agenda applying an inequality lens. Yeah. Let me first show this slide. I don't expect you to read all of that. But you remember that the year 2000 has seen under or among the MDGs an MDG target for drinking water, for access to drinking water and basic sanitation. And it has been the first time that the international community has set such a target. And the impact of having set such a target was tremendous. Even if we still lack millions and billions of people without access to basic sanitation and access to drinking water. But lots of progress has been made. And the protocol on water and health, I think, is an excellent example for that. Now, however, this MDG agenda missed to address the wider water challenges. It missed to address issues related to wastewater management and issues related to wastewater management and issues related to water resources management and water quality. So what we call for is that the ambitions for 2015 have to be different. Most of you may have followed, beginning of this year, the global thematic consultation on water under the UN lead. And this global thematic consultation on water has come up with a proposal along 3 pillars. Switzerland has taken this as a basis in order to draw on the 3 pillars a position paper which we have shared with you in a handout. And that's exactly why I don't go into this detail, but basically what we say is we have to look at universal access to water, sanitation and hygiene, what we commonly call WASH. But we also have to look at water resources management, and we have to equally address the issues of wastewater management and water quality. Switzerland has come up with its general position regarding the key priorities for the post-2015 agenda with water as a priority. But you also have to look at nexus targets. We all know that water alone is not going to change the world. So we have to look at nexus that link water with health, that link water with energy, that link water with food security, in order to just take a few of these linkages and synergies. Now, what does it mean fighting inequalities? Yes, we have to address the unfinished business of the MDGs. And this means particularly tackle neglected issues. It was said by my previous speakers that we have adopted the human right to water and sanitation. So we are going to look at universal access. And universal access is a completely different paradigm compared to halve the portion of people without access by 50%. Because universal access means also reduce inequalities. It means to look at disadvantaged, marginalized, vulnerable groups, which are the most difficult to reach in most of our countries. So we can no longer go for the low-hanging fruits, meaning low-hanging fruits to go for access to that share of the population that is the easiest to reach, that is the easiest to achieve sustainable services, because they can pay a reasonable part of the costs of water and sanitation services. But we also have to look, and particularly to look at gender issues. And as said by my colleague Graham Alabaster, we have to go beyond basic access. Open defecation free and simple basic pit latrines is not what people in Africa, Asia, and all the rest of the world are looking for. So we should, within this new agenda, look for solutions that go to a higher level of sanitation solutions, specifically when it comes to sanitation solutions, but also to drinking water solutions. But as said, we have to widen the MDG focus when we are thinking about the post-2015 agenda. We have to look at water resources management and wastewater management, as well as water quality. Why water resources management? Well, if we want or not, it will probably take us another 2 decades or more to reach populations in rural areas, populations far away from bigger towns and capitals with access to water, to drinking water, through systems that bring them drinking water straight into their houses. So they will rely for a reasonable time on very simple surface water and groundwater resources. And meeting the target on WASH, on water quality, but also on disaster resilience cannot be or will not be the case without achieving equitable water resource targets. To reconcile competing demands, is only possible if we have a water management that is equitable and sustainable and gives priority to the basic needs. And there is, of course, a need for governance reforms in the water sector and also physical and natural infrastructure. Why wastewater? Wastewater pollution from urban, industrial, and agricultural sources have devastating impacts on human beings, on their health, on their economies, on their environment. And without wastewater reduction and treatment, there will be no quality water for the most marginalized and vulnerable. So how can we build this in, please? How can we build this in? Water resources management targets and wastewater targets. Looking at the water resources management targets, there are different issues. I just want to mention 4 here. Priority must be given to personal and domestic water uses. Otherwise, the realization of the human right to water and sanitation and the achievement of WASH targets, on future WASH targets, will not be met. When we look at productive use of water, we will have to give priority to basic human needs. So basic human needs must come first. And I'm thinking, for instance, on growing food. Extraction from surface water and groundwater resources must also protect the rights of small landholders, communities, and indigenous people. And when we think about climate change and water-related disasters, we have to ensure specifically the resilience and protect the most marginalized and vulnerable. So these are elements which we would like to see to work into even our proposal I have shared with you. As this proposal is an ongoing process, we are in constant contact with all UN agencies that are working on the water goal and also a lot of other bilateral partners. Looking at sanitation and wastewater management, it was said also by my colleague that we have to prioritize areas where the exposure is greatest before we improve services in areas that already met the standards. We have to accelerate and improve the collection of fecal sludge in low-income areas. And we have to monitor the situation of the disadvantaged and affected and most affected by contamination, thinking particularly on the highly toxic industrial wastewater, but also agricultural runoffs. And funding must be prioritized for poor rural and deprived urban areas. Now this is my last slide, and this is a call actually for action when we are going for the post-2015 agenda. Caring about water today is the best and most economic way of guaranteeing clean water for the future generations. I think this is a very basic, very simple message, and we all know it's true. The other message is only if we share water resources and jointly manage water resources, we will have enough water for all. Now that's why we call for water to be a prominent and key element in the post-2015 development agenda, and why we call for a dedicated goal for a water-secure world. Water secure in the sense having water for all our uses, for all people, for today and for the future. And we all know water is at the basis for almost every activity, for almost every process that human beings are involved. So having to address the water crisis means also having to address different other crises in water-dependent sectors. So I invite you as delegates of different countries to be active partners in the upcoming negotiations in the post-2015 development agenda, and to assure, together with the water community, the stakeholders in the UN, and a lot of other bilateral countries that already are standing up and calling for a dedicated water goal in whatever the agenda is going to look like for the next 15 to 20 years. Missing this opportunity means missing the opportunity till 2025 and 2030. And I think we can just not afford that in the world we are all living in. Thank you very much.
Thank you, Mr. Thornhofer, showing us the interconnected and integrated nature of water and its problems, and also showing us a vision to 2015 and beyond. We are now moving to the next session, and I would request Mr. Thornhofer and Mr. Alabaster to stay in the podium. The next part of this session is to receive statements, high-level statements from some of the countries. And the international cooperation is important to secure equitable access to water and sanitation globally. And to start the first statement, I would like to invite Mrs. Carola Björklund, Ambassador to the Council of European Affairs of the Ministry of Foreign Affairs in Norway, to open this section. Mrs. Björklund has been the solid pillar behind the project facilitation mechanism of the protocol, as well as the establishment of the water fund at the EBRD. Ms. Björklund, please.
Thank you very much. We have heard many speakers referring to that access to water is a human right. I will not dwell with that. But I heard the Swiss representative saying something about that we should be more ambitious than the MTDs, which runs to 2015. You talk about universal access. And I think that my government will go along with that. But the question is, I didn't hear much about the financing of how we should reach this universal access. In my statement, I will talk about also financing and how we cooperate in order to safeguard that we can really improve the access to water and sanitation for all the people. We heard the French saying that no one left behind. We do believe in that sentence too. Let me stress that the main theme of the Protocol of Water and Health is to safeguard access to safe water supply. But at the same time, we know that in Europe today is the only continent in the world where progress concerning sanitation challenges seems to be stagnating. This is alarming information. We do believe that safe water supply and adequate sanitation services are of fundamental importance for public health and are essential to all development efforts. The current situation is unacceptable, and the governments in the pan-European region need to give water and health higher priority in the National Development Plan. Equally, donors should consider increasing investment in these activities. We thank France, who put this subject on this issue on the agenda under the Protocol of Water and Health. Equitable access is very important. We also would like to refer to that donors should consider increasing the activities and through, for example, cooperation between the EBRD and the UNECE and WHO Protocol on Water and Health. We think that is promising and can contribute to the partners can provide increased access to necessary means to implement the specific goals and concrete targets on how to improve the access to water and health. While water is essential, it's also important to pay adequate attention to how to secure the equitable access. The Protocol of Water and Health stipulates that equitable access to water and sanitation and adequate in both quantity and quality should be provided for by all members of the population, especially those who suffer of disadvantage or social exclusion. It's further stressed that special consideration should be given to the protection of people who are particularly vulnerable and to water and related diseases. Equity is also mentioned in the new work plan or the protocol, and we think that's very important. In order to safeguard that no one is left behind, there are 3 particular dimensions that should be observed. First, geographical differences in access and price gaps for service provided. Second, discrimination and exclusion in access to services by vulnerable and marginalized groups. And the third, financial affordability should be also, by the user, should be observed. Countries and member states have different possibilities to reach these goals, and the international society, including international financial institutions, should therefore be more targeted to assist these countries in need of financial support to develop and improve equitable access to safe water supply. Working together, then we can obtain synergies and we avoid overlapping, and we will have better use of every euro that we invest in the water sector. Let me conclude with proposing 3 measures that we should take on board in order to improve the access to adequate water and sanitation, and having such access finally to be reached to all. I think that first, a result of differences between countries in terms of availability of water resources, socio-economic development, access and public policies, efforts should be made by all countries to realize the goal of equitable access for all. Second, by establishing cooperation between, for example, EBRD and the protocol, these institutions have demonstrated how such cooperation can be mutually beneficial for the organizations, and in particular being supportive for member countries needing financial assistance to implement the targets set under the protocol. Such cooperation has the potential to offer a possibility to safeguard equitable access to all members of the country's population. Third, finally, we will have, while each country has the obligation to provide water and sanitation to all, the international community should contribute to, and with common effort, ensuring that the water quality and the water bill is affordable for all. This requires a long-term strategy, and we welcome the initiative and the cooperation between UNECE, WHO, and EBRD that has initiated and taken this goal very seriously. And I also would refer to the new chairman, Pierre Studer. You said that you expect proof of action for the next work plan. We share your views and ambition on that. To this end, I would like to refer to what Norway has done the last years. We have contributed to that Ukraine, Tajikistan, Kyrgyzstan will be able to set targets, and Ukraine has already finished the targets. But in order to safeguard that these 3 countries can implement these targets, we need international cooperation, and we're very happy that we will have EBRD on board tomorrow, that we can talk about financial means in order to safeguard that we have universal access to. And finally, I would say that with common efforts and with international cooperation, we can make change. Thank you very much.
Thank you, Ms. Björklund, and thank you to Norway, confirming again that they will be working together with others in the international community to finance the member countries' activities. I will now invite Mr. Chingisbek Uzakbayev, Minister of Agriculture and Melioration of the Republic of Kyrgyzstan, to address the audience. Уважаемый Chingisbek Makesevich, это приглашение для вас, чтобы...
Yes, I'd like to invite you to take the floor, sir.
Спасибо.
Thank you very much, Chairman, distinguished ministers, distinguished participants, ladies and gentlemen. On behalf of the delegation of Kyrgyzstan, I'd like to thank the UNECE, the European Regional Bureau of the WHO, for the invitation to participate in this meeting. We fully share the provisions of protocol that state that ensuring equitable access to water from the point of view ensuring the adequate quantity and quality should provide all members of the society, those that are in a difficult situation. Kyrgyzstan is not a party to the Protocol on Water and Health, but realizing the importance of the need for our country to resolve the different problems in this area that we have, and also realizing the importance of international cooperation. As part of the national dialogue on water policies in Kyrgyzstan, we have carried out substantive work in establishing target indicators in connection with the protocol. Considerable attention in this work, and this has been done with the support of the UNECE and the Foreign Ministry of Norway. Considerable work was devoted to questions of ensuring equal access to water to all citizens of the country, and a plan for implementing measures of reaching these target indicators was approved by the decision of the Minister of Agriculture and Territorial Development and the Minister of Health, Kyrgyzstan. We do also hope that as we implement our different ideas and activities in the context of the Protocol on Water and Health, Kyrgyzstan will have better opportunities to show all of the work that it has been doing in connection with attempting to solve problems related to water, and also participate in the international process of taking decisions on all these issues in this very important work. Thank you.
Thank you, Mr. Zakbayev. Bosnia and Herzegovina has ratified the protocol this year, and we are glad that the Deputy Minister of Foreign Trade and Economic Relations, Mrs. Ermina Salkiewicz-Dizadarevich, is here today. Madam, the floor is yours.
Thank you very much, Mr. Chair, and let me congratulate you on pronouncing my last name. It's a success, believe me. Their Excellencies, Mr. Chair, dear guests, friends, on behalf of Bosnia and Herzegovina and the Ministry of Foreign Trade and Economic Relations to Bosnia and Herzegovina, I would like to say that it's really my great pleasure and honor to be at this really important meeting of the parties to the Protocol on Water and Health, to the Convention on the Protection and Use of Transboundary Watercourses and International Lakes. I would say just a couple words regarding Bosnia and Herzegovina and the protocol itself. A large number of countries signatories to the protocol reflects, among other things, that its significance and importance in meeting one of the basic human rights, the right to water, which has special significance, especially at the time of dynamic economic growth and social development. Water, even to a very simple chemical substance, is a key element of human existence as well as of all other life in Earth. So Bosnia and Herzegovina is a country rich in water resources. According to the World Bank, Bosnia and Herzegovina is the country with the largest quantities of the drinking water in the region and 7th in Europe. And by water resources, it is richer than many countries in the world. So, aware that these resources are not limitless, we are firmly committed to working towards protection and sustainable use, as well as the establishment of access to the drinking water for everyone in accordance with the provisions of the protocol. Bearing in mind that the key commitment of Bosnia and Herzegovina is its integration into the European Union, the reform and priorities in the water sector are focused on the implementation of European legislation. Bosnia and Herzegovina, as a potential candidate for the EU membership, assumed partially or completely all of the key objectives of the EU legislation in terms of water management and incorporated them into its legal and strategic documents. Main challenges of Bosnia and Herzegovina's water management policies are related to the proper implementation and achievement of the objectives of the Water Framework Directive, Directive on Drinking Water, and the Directive on the treatment of urban wastewater and other directives which allow integrated management of water resources. Through achieving and implementing the objectives of the mentioned directives, we will also achieve a large part of the main objectives of the protocol itself. Taking into account in particular the financial crisis that currently exists in the world and in our country, of course, as a small country in transition, without support, international cooperation and exchange of experiences with other countries is not able to implement the basic objectives or is not be able to implement the basic objectives of the integrated water management. Therefore, the cooperation between the protocol and other international conventions hold enormous significance for us. Finally, I want to say that Bosnia and Herzegovina will give its full contribution to the realization of the goals and joint cooperation through the protocol and will contribute to the objectives of the better access to safe drinking water and sanitation for as many people as possible. Thank you very much for your cooperation and for having us here. Let's work together. Thank you very much.
Thank you very much, Ms. Stalkicevic-Dizdarevic, for your commitment and also the vision which you have shown to us what you are going to do in Bosnia and Herzegovina. Moldova is one of the first countries which adopted the national targets along the protocol on water and health. I invite Mrs. Svetlana Kotelja, Deputy Minister of Health of the Republic of Moldova, to share with us your challenges and success stories as a way forward to secure equitable access to water and sanitation. Please.
Thank you, Mr. Chair. Excellencies, ladies and gentlemen, since becoming a party to the Protocol on Water and Health in 2005, the Republic of Moldova has progressively strengthened national capacities to ensure better access to safe water and adequate sanitation to all people in the country. A key focus of these efforts has been particularly on addressing the equity dimension and giving special attention to those who are most vulnerable. Significant disparities among different population groups in our country hamper achieving the overall goal under the protocol, universal access to water and sanitation. Thus, 84% of urban population has access to improved sanitation, as opposed to only 40% in the rural area. Similar inequalities exist in terms of geographical regions as well as the settlement size. Recognizing the needs to address prominently the most disadvantaged, we have considered a focused approach to the activities developed under the protocol implementation. This is also reflected in the set of national targets developed and approved for the protocol implementation, which are focused on the most vulnerable groups. I am pleased to mention today the important progress made under the protocol framework during the last years, specifically in terms of increasing access to improved drinking water sources. First, compared to the baseline year of the protocol implementation in our country, it has raised from 17% in 2005 to 35% in 2012 in the rural area, reducing the gap between urban and rural regions. At the same time, special attention is given to achieve target on ensuring the schools' access to improved sources of drinking water. Following the Parma Declaration that recognized children as a vulnerable group, Republic of Moldova set a target to provide each child with access to water and sanitation in homes, childcare centers, and schools by 2020. A progress has been achieved in this area as well, with access increasing from 69% in 2009 to 82% in 2012. From the health perspective, access to water and sanitation is a major social and environmental determinant of health and could generate itself significant inequalities in the health status of different populations. As it is emphasized by the Health 2020 policy framework, cross-sectorial cooperation is crucial for bridging the disparity gaps. Republic of Moldova has been successful in establishing mechanisms for joint action across the sectors at different levels. work under the Protocol on Water and Health set an operational platform for close cooperation between the Ministry of Health and the Ministry of Environment, and the other authorities still need to be involved more. Currently, Republic of Moldova is taking important steps forward in the implementation of the Health in All policy approach and building capacities across sectors. The second edition of the National Health Forum that has launched today in Chisinau is bringing together all relevant partners from different authorities to discuss healthcare in the light of cross-sectoral partnership. Moldova is committed to work further and to ensure implementation of the program of work for 2040-2016, transposing Protocol on Water and Health into practice and eliminating disparities in access to safe drinking water and sanitation. Finally, I wish to conclude by expressing our deep gratitude to the World Health Organization Regional Office for Europe and to the United Nations Economic Commission for Europe for the priceless assistance in ensuring progress in the implementation of a protocol until now. Thank you for your attention.
Thank you, Ms. Kotelia, sharing with us how the protocol on water and health and the targets have streamlined the work what you have done and the good progress that you have achieved during the last years. Serbia has ratified the protocol this year, and I would like to invite Mr. Milan Simurdic, Ambassador of Serbia to Norway, to address the floor.
Thank you. Mr. Chair, Excellencies, respective delegates, ladies and gentlemen. Please allow me to begin this statement by expressing my great pleasure that the delegation of Serbia is for the first time participating at the high-level meeting of the parties as a party to the Protocol on Water and Health. Let me extend compliments to the organizers and Norwegian hosts. In the Republic of Serbia, overall 99% of urban and 98% of rural population have access to improved source of drinking water. Nearly 100% of the population of Serbia is living in households using improved sanitation facilities. One of our priorities is to increase the access to potable water for disadvantaged groups. The action plan for the implementation of the strategy for improvement status of Roma population in the Republic of Serbia for the period 2012-2014 has foreseen the measures for improving living conditions in the Roma community by providing safe drinking water supply and adequate disposal of waste. In the Plan of Action for the Environment and Health of Children in Serbia, adopted in 2009, the first priority regional goal refers to safe drinking water and adequate sanitation. Recognizing the importance of effective promotion of the Convention and the Protocol on Water and Health for further better implementation, responsible ministries of the Serbian government presented the protocol on national and local level in Aarhus centers, municipalities and nature protected areas, in order to raise awareness of the protocol's provisions and benefits, to support cooperation between authorities and different stakeholders, and motivate local government representatives, emphasizing that protecting of drinking water supplies is a local priority. In pursuance of the provisions of the protocol, the government is ready to ensure its implementation and to support the joint sector group headed by the Ministry of the Health. The government is also devoted to respond to the obligation to establish and publish targets and targets data as referred in the Article 6 of the protocol. Ladies and gentlemen, at the end, please allow me to take this opportunity once again to express my great pleasure to be here today as head of the Serbian delegation and to highlight our strong willingness and commitment to cooperate with all of you on our goal to eliminate disparities in access to safe drinking water and sanitation. Thank you.
Thank you, Mr. Simodic, for that statement and confirming your commitment to work to achieve the targets that we all want to achieve. Participatory approaches are important for sustainability and to secure the relevance of national actions towards securing equitable access. I now invite Mr. Unit Ciprian Yuga, State Secretary, Department of Waters, Forest and Fisheries, the Ministry of Environment and Climate Change in Romania, to address the session, please.
Thank you, Mr. Chair. Excellencies, ladies and gentlemen, the Protocol on Water and Health brings together and mobilizes water and health sectors in order to work together with the aim to increase access to water and sanitation, improve water and drinking water quality, and prevent water-related diseases. The work means to develop, to develop and to implement policy, strategies, and programs through projects and investments. Who are the beneficiaries of these policies and investments? The individuals group of people, local communities, interest group, associations, the public. For this reason, public participation in the decision-making process must be an integral part of any policy, project, or investment concerning water and sanitation. Public participation will allow to express their interests and priorities, their experiences and ideas, to plan for themselves with the aim for a better coordination of the development of the community. Participation means collaboration for mutual objectives, acceptance of responsibilities, and sharing of benefits as well. Participatory approach to development on water and sanitation is built on the basis that the communities support effective project implementation and enhance the well-being of the people, especially for the poor. The questions are, is the participation a true one? What is the role of governments, communities, stakeholders, non-governmental organizations? Is participation effective and in the interest of community? Are the decisions taken in a transparent way? Are the voices of poor or marginalized people heard? The Protocol on Water and Health stipulates that the states should be guided by several principles related to human rights, including equitable and adequate access to water for everyone, access to information, public participation, and special consideration for vulnerable groups. We all know that there are different levels and types of participation. We need to have instruments to guide us in making this participation an effective one and increasing people's willingness to participate. For this reason, we strongly believe that the guide to public participation under the Protocol on Water and Health, developed under the Program of Work 2011-2013, under the coordination of Romania and Women in Europe for a Common Future and financial support of Norway, will be provide to needed assistance to governments in improving the public participation in the water and sanitation issues and health as well. This document is also addressed to the public to be informed about the process of participation and therefore to increase their willingness to participate in the decision-making process. Governments and non-governmental organizations have an important role in disseminating this document to the public as well in its translation into national language. In Romania, all the population groups have the right to access the safe drinking water and basic sanitation. The legislation in this field refers to the granting of drinking water supply for population and public sanitation as well to the rational and balanced distribution of water resources. The Romanian Constitution stipulates that the state is obliged to take measures in order to assure the hygiene and public health. The actions of the Romanian authorities are oriented to the extension of centralized drinking water supply and sanitation systems, including those within the disadvantaged areas. The provisions of the specific legislation on water and sanitation require the access and participation of population in the decision-making process. For example, according to the provisions of the Drinking Water Quality Law, the authorities with attributes in the field of drinking water supply should be ensured to adequate and updating the information of quality of water intended for human consumption. The access to information and decision-making process is also provided by the water law and is available for all the population groups, no matter of their incomes. In case of regionalization, the users connected to the water services in urban areas provide direct or indirect financial support to users in rural areas so as to facilitate their access to water and sanitation. In some cases, they are granting subsidies to reduce the price of water services in the rural areas where the provision of these services is particularly expensive. For instance, this is the case of the families with the residence in one of the localities of the Danube Delta Biosphere Reservation territory. I give these examples at our national level just to show that even providing water and sanitation for all is not an easy task. We could find or think of different solutions. All you have to consider is that the water is essential for our health, and the health is most precious wealth we have. We think that the protocol on water and health is the best platform to share the experiences in this field and to think for common solutions. Thank you very much for your attention.
Thank you, Mr. Yugar, confirming the importance of the protocol of water and health in achieving equitable access and the importance of participatory approach in identifying the needs and also achieving the goals. Now I would like to invite our keynote speakers to give short comments, if they have any, to these statements. First, may I ask Dr. Alabaster to give your comments, please.
Thank you very much, Mr. Chairman. I think there are 4 points that I picked up from the presentations from the distinguished delegates. First off, the issue of financing, and I think that this innovative relationship between the development banks is really welcome and is